Has appropriate meeting notification been made?
Yes, Your Honor, it has.
Would all please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty. Thank you. Roll call, please.
Alderman Zaffel.
Present.
Alderman Ellis.
Here.
Alderman Spiegelberg.
Here.
Alderman Mulder.
Here.
Alderman Shellpepper.
Here.
Alderman Kavieski.
Here.
Alderman Rogers. Alderman Rozak.
Here.
Great. Look for a motion for approval of the meeting minutes, June 16th, 2020.
So moved. Second.
All those in favor?
Aye.
Any discussion? So moved. Let's move on to item number 5 with the comments and suggestions from citizens. So I'm very, very pleased tonight to introduce some folks that are going to help our council become more updated and give you a chance for question and answers with regard to COVID-19 issues here in our community. So we're going to have a presentation, an update, and then an open discussion for council members. After that's completed, then we'll move into B, which is a citizen comment. So Chief Bowen, if you would like to bring everyone up and just introduce everyone, that would be much appreciated. And big hands and hats off to these folks for coming to help inform us, and also for those in our community that will be able to live stream or be able to watch us later to understand kind of where we are today and give you some professionals to ask some questions.
Thank you, Mayor.
Thanks, Chief.
Chief Brad Bowen, Western Lakes Fire District. I know Captain Pfister from City of Oconomowoc Police is present as well as part of this presentation. But for those that haven't met Dr. Chuck Cady, he is the district's medical director. He works for Pro Healthcare out of Waukesha, Mugwanago. In the past, he was the state of Wisconsin's EMS state medical director, as well as working at Frederick and the Medical College of Wisconsin. Did I cover it all?
Yes, thank you.
All right, so Dr. Cady has been a part of the joint EOC since the COVID pandemic, and he oversees the district's EMS operations. We essentially operate under his medical license, so that's why we thought it would be good to introduce him to you all and then provide some information to you. So well, what I did is just updated the PowerPoint that Chief Berger and I did back at the beginning of May, just to give you an updated status about 2.5 months later. So our response continues. Department heads locally within the city here continue to work out internal policies, whether that be mask wearing with public interaction, masks in confined work environments such as small office spaces, adjusted work schedules, and screenings of employees. At this time, that's all at the local department head level to implement those changes and those local policies or guidelines for them. Completing regular hand sanitizing, sanitization of the desks, the countertops, et cetera, disinfection, as well as making sure hand sanitizer is available. With regards to the monitoring that the EOC is doing in the communications, we continue to meet weekly as our joint EOC, the mayor, Mr. Duffy, Captain are all a part of that. And we discuss local trends as well as local policies that are put in place by the policymakers at the various municipalities. We're monitoring our emergency management case counts. We've seen increased testing, so we're seeing increased cases, but also the local hospitalizations. And Dr. Cady has been instrumental on telling us what we really need to be looking at, and it's not just the number of cases. So here are 2 hospitals. We are fortunate to have 2 hospital systems in our community. We're monitoring what their admissions are, availability, as well as southeastern Wisconsin and nationwide. Cap, do you have anything to talk about with your local policies with the PD?
Yeah, I can step in at this point. So locally, the police department, effective on Monday, we have switched to all of our officers, when they get out of the vehicle, are now wearing masks in contact with any citizens. Internally within the police department, we're also wearing masks inside the building. Being such a small space, we're kind of confined and on top of each other. And a lot of the reasons are behind that. As you'll see, some of the numbers that are coming up, the age group primarily that's coming down with COVID is that 23 to 32 group, which is primarily the group that we deal with outside. And obviously being critical response for us and critical employees, you know, we get one person to go down, could lead to more, and then we have staffing issues within the department. Recently, there was a department outside of Waukesha County in Jefferson County that had an incident that affected 5 of their deputies at one point. So we're trying to avoid that and taking all precautions, including the stuff that we had already implemented with the cleaning, the disinfecting of our squads and so forth at this point.
The preparedness continues the same slide that we showed you last time. Nothing has changed with regards to our preparedness and our programs in place there. But current data, so within the district that we serve, the 11 communities, but focusing in on the 6 communities here, 7 communities here in Waukesha County, we've had 219 reported cases since the start of the pandemic. 82 of those remain active, and unfortunately, we did have 1 fatality. Locally here at the city of Oconomowoc, we've had 80 positive tests, 33 remain active, and unfortunately, the 1 death was here in the city of Oconomowoc. We're seeing some community trends. It is community transmission. That was something that was up in the air early on, and about middle of April is where we determined that it was community spread. And also what we're seeing now is when we get a case reported, we're seeing multiple cases in the single household. Because it's being transmitted person to person within that household, which a little bit later we'll talk about just the quarantine methods, which is where Captain talked about some of the methods and programs that we put in place for our staff so that we don't have a shortage. And I heard Lori talk about it with her department, is the shortages of staffing. We're also seeing hotspots. A lot of our hotspots are isolated around the lakes. The lakes are a lot busier than they historically are this year. And when we look throughout the district, a lot of our hotspots are residences and locations around the lakes. And our call volume for the district has returned back to normal after 3 months of shortage. We're actually exceeding our normal call volume. So this is just the breakdown of what's going on in the other communities. I thought this was an important slide, and this is one of the key points that Dr. Katie said that we need to be looking at as the EOC, is the hospitalizations. You'll see early on, and this is hospitalizations in Waukesha County by week. Early on, we saw the spikes where we were seeing in excess of 20 hospitalizations a week. Then we saw a drop-off in the beginning of May through really the beginning of July. It's starting to trend upward. You'll see that last column, July 19th. That's this week. That's not yet complete. But the last 2 weeks, we've been hovering right around that 10, 12 hospitalizations in Waukesha County per week. Doc, do you have anything to add, or did I?
No, I think that
Okay.
that's good. I think that's a good.
So this is a comparison, and this is something that I've provided for council as part of your weekly updates on Fridays. On the left is what you saw in your report on Thursday, which is southeastern Wisconsin's available ICU beds and inpatients that are admitted. So comparing Thursday, when this report was ran, to today this report was ran, we can see that there was an uptick in ICU admissions in southeastern Wisconsin, as well as total patients that have been admitted into the hospital systems, going from 54 up to 71. Then the next slide is the key, is we're trying to prevent the surge and limitations on the healthcare systems, is the available beds. And this is southeastern Wisconsin. On Thursday had 109 ICU beds available, and today they have 103. So we're monitoring that, and that's the key information that Dr. Katie, our EOC, is monitoring, as well as our hospitals. And they're not just looking at southeastern Wisconsin, they're really focusing on what's happening down south, because they are at capacity. So they're trying to monitor those trends and see what happened down there and pre-plan for what could occur up here and come up with preventative methods to prevent that surge up here. Anything on that, Doc?
No.
So these are the things that we're monitoring, is EMS call volume. We do still have the pandemic card in place, which is dispatch screening every caller. And then we are at level 1, we can go up to level 4. If we reach level 4, that's because the call volume is exceeding the resources in Waukesha County. Throughout the pandemic, we have not exceeded level 1. Like I said, we are seeing an increase in call volume, as well as others. We're running about 8% higher call volume in the last 4 weeks than we typically do. And we'll continue to monitor that. If all of a sudden we're creeping up into the 24% higher, we might move to level 2, which means we're going to filter out what's called the pandemic card cases, and they might be a non-emergency or a delayed response to take care of priority calls. On the right is the different dashboards that are available to the public to monitor what's going on. Is the Waukesha County dashboard, the Wisconsin hospitalization dashboard. That's where I'm getting the data for the ICUs. They're required to put that data in every day so that that's available for emergency management and public health. COVID Act Now is also online, the CDC and Johns Hopkins. So after and future action continues as far as planning, making sure we have equipment. But ultimately, we wanted to provide you with an update. Dr. Katie's here to answer any specific medical type questions that you may have. You're the policymakers, and that's why Mayor had asked us to come and provide you an update.
Oh, thank you. I'd like to make a brief comment before we open it up for discussion. As policymakers, Councilman, you have the option to look at potential proactive policy. We have the opportunity to react to things when they happen with reactive policy. And we have the opportunity to say, hey, we're good and we're not going to make any policy changes. That's in your control. What I want to know from you at some point is there something you would like us to pursue? Are there resources and information that you need to help you make decisions in the days, weeks, months ahead as our policymakers? So we will allocate those staff resources to help give you that support as you feel it's necessary. And what I thought we'd do is have Dr. Katie, if you can come up to the podium. First of all, on a personal note, just thank you very much. Your insights on the EOC meetings have been very, very helpful, and we appreciate the extra things that you're doing. You truly are a hero, sir.
Absolutely.
And
Thank you. I appreciate that.
Thank you.
It's important that we work on this together, so.
Great, thank you. Do you have any comments to start, or should we open up for discussion? It's kind of
Open discussion, and I'll respond as needed.
great. Any questions? Alderman Rozak.
Thank you, Doctor, for coming out tonight. Out of the presentation, there was one question I had, which was, well, two. One's for you, one's for Chief Bowen. When you say active case, what does that actually mean? Are they actually in the hospital, or are they just being monitored because they've tested positive?
And they're not even necessarily being monitored, but they're positive. They have disease. We believe that they're still infected.
They haven't recovered, in
They
other
have not
words.
recovered, yes.
And so when we look at an active case, we're talking about someone who is infected, maybe not even in the hospital. Could be at
Correct.
home, could be isolating.
Correct.
And we're just checking them out. And then at some point, when do we find out if that active case has gone away? Do they report back to us? Do they report back to Western Lakes or the city somehow? Or are we just assuming that after 14 days, if we don't see them again, they're good?
The health department should be following up on this and double checking that they're doing okay. But for patients that are sick enough to be hospitalized, those patients might get discharged with a certain direction as to what they need to do, where they're going to go. And depending on how serious they are and what their comorbidities are, they may want to come back in and be retested to make sure that they're negative. And the current guidelines, if we test to be negative, you test and then you have to take a second test in 24 hours. You have to have 2 of them negative.
Okay.
But we aren't testing everybody to make sure that they've cleared their disease. If a person comes into the hospital and they don't need to be admitted, but we've diagnosed them with COVID, typically in the ER, we diagnose them, we think you have COVID, but the test is pending, and the test comes back 24 to 72 hours later. We give them the instructions ahead of time, but if it's positive, what they're supposed to do is they're supposed to self-isolate, and they need to do that for a minimum of 10 days from the start of their symptoms. After that 10 days has occurred, they need to be fever-free for 24 hours without Tylenol or ibuprofen, and they have to generally be feeling better. And that meets the criteria of it no longer being an active case. So a lot of that's kind of left to the individual to follow and ensure that they're but the idea is that most patients that are diagnosed should be free and clear in 10 to 14 days.
And this one, the next question's for you, Chief Bowen. How many people, and this is just ballpark, in the entire Western Lakes Fire District area that you're monitoring, so we're seeing these numbers, 219 cases positive. What does that mean, how many people?
You mean how many,
In the
like what our
whole-
population is?
Yeah, well,
or-
yeah, approximate population. I mean, we know Conomox's what, 17,700, but
So the district, in my 219, unfortunately, Jefferson County Public Health and Dodge County Public Health are not as transparent as Waukesha County. So I don't have the cases in those two counties included in that 219. But our population here in Waukesha County that the district serves is roughly 34,000 people. So that's the population served. And I did just want to follow up on your first question with regards to public health. You know, when somebody does come back as positive, public health does call them. They're required to do twice a day temperature monitoring, case and symptom updates. They report that all to public health. Public health has been under 24 hours of doing the contact tracing, which is where they call anybody that you've been in contact with, talk to them about quarantine, whether they need to or not. And that's, you know, one of the reasons that police and fire especially, and I know some of the other department heads have implemented it, is if you are exposed, public health, and it's a significant exposure, is forcing you on a 14-day quarantine. And that's what we're trying to prevent in our department, and I know Captain Pfister is trying to prevent in his department with our local guidelines for our staff. But the public health, when somebody's cleared, we get a notice, so that's how they're coming off of our lists, and I know you had asked that question.
yep, that's perfect, thank you. Yeah, that's good, thanks.
Alderman Zapfel.
Chief. Thank you, Chief and Captain and Doctor, for your presentation. Truly appreciate it. I've noticed the Western Lakes Fire District, you guys have been wearing your masks, and I haven't talked to other firefighters around the state. Is this in their personal time as well that they're wearing masks, or just while you're on duty?
We are not mandating anything on their off-duty time. We have released guidelines, kind of best practices to our staff. We haven't implemented anything off-duty for them. And our internal policy of district quarters, I had a conference call with some of the other full-time departments throughout the state of Wisconsin to talk about their internal policies. And it's about 60-40.
Sure.
60% are following the same policy as us. If you're, because we're screening our staff every 12 hours, no mask if you're in an apparatus or if you're in a facility, but if you're engaged with the community, because we just don't know, then we wear a mask.
And if I'm violating any HIPAA laws here, Stan, yell at me, please. Have there been any positive cases from any of the employees in the police department or Western Lakes?
For Western Lakes, we do have one, but they did not create any exposure to our staff. They were off work for 14 days prior to developing symptoms, and then they were tested and are quarantined. So they were not working in the 2 weeks prior to that, so.
And I can say for the police department, we've had 2 people tested, both came back negative, so no positive.
Thank you. Yeah, no, I've been tested myself. It's scary to get poked up your nose. I've gotten the results back within a timely fashion, and I've isolated myself during that time period, so I, completely understand in regards to that. Sorry to ask another question here, Captain and Chief. Do you guys feel that the masks are working?
Maybe doctor.
Or Doctor?
Well, if you don't mind, I think they work. It makes sense to me from a medical standpoint, and I think they're working. From a employer standpoint or a district standpoint, we're putting masks on patients. We're wearing masks, and that really cuts down the exposure. So if I put a mask on a COVID patient, I have my mask on, and they become positive for COVID, we don't count that as an exposure. It's a contact, but it's not an
Sure.
exposure because we've taken the appropriate controls. My fear, and again, we can't mandate our paramedics and EMTs to be wearing masks when they're off duty, but let's say they go to a graduation party.
Mm-hmm.
If they're at a graduation party and they're sitting at a party and one person has a mask on, they have a mask on, and that person becomes positive, we would not consider that an exposure. If they go to that party and the 2 people are sitting together and the one becomes positive, well, now that's an exposure and that person's off duty for 14 days monitoring. So from a policy standpoint, the masks keep our employees able to continue to work and to function. And I think just my experience in healthcare, when I look at you know, what we're doing in the ER, the number of COVID patients I've seen, my colleagues have seen, the nurses and techs have seen, we're not all catching it, we're not all dropping from COVID, and I think it's because we're wearing masks and taking those precautions.
Yeah, I saw that study where 2 stylists tested positive and 139 of their customers did not go positive when the stylists were wearing the masks.
So, you know, they're not 100%. It's not gonna prevent everything, but I do believe that they cut the risk down significantly.
Thank you.
And also for the council, just so you're aware, Kevin Freeberg is also here in the audience. And if you have any departmental or safety questions, he's here to answer your questions as well. Alderman Ellis.
For, I guess, Chief Bowen. In reference to businesses in the city or just in your region, if an employee is found to have COVID, what is the protocol now when you find out that there could be a concern, especially like for the eateries?
So it all depends, you know, I don't know, you know, I know for us, because we're the emergency management and the EOC, I'm getting the names of cases. Now, if that employee wasn't in the public health's contact tracing, I honestly don't know if they're gonna call their employer if they were off work for 2 weeks. Public health is the one that takes all of the positive cases and then does the contact tracing and tells the people, the individuals, who has to be quarantined and who doesn't. So that's actually a public health order, and I believe we talked about this early on with the police department. It's not the fire department that does the enforcement, it's not the police department that does the enforcement of the quarantines. That's a public health quarantine. So with regards to employers having employees that tested positive, which, you know, there's 219 people that tested positive, a number of them are employed somewhere. That is public health's order, whether they have to quarantine, whether the business has to quarantine, and it all depends on the amount of exposure for that individual or individuals.
So who calls public health?
Who calls public health?
Right.
They're the ones that are getting all the positive test results back. So they've got the information. That's the clearinghouse of everything.
Okay.
And then they have their contact tracers move forward with the quarantines from there.
Thank you.
Alderman Kavieski.
One of the three. There have been, eeny, meeny, miny, moe. There have been some testing that has come back positive, and it's a false positive. I actually have knowledge of three people who have been tested positive, gone back in, and it's been negative. When that occurs, how do the numbers get updated? Do they get updated? Is that reflected in on?
Yeah, so there was two questions that came up today, and I can add that one to my question list and report back in my written report on Friday. But the question also came up is, so you tested positive today, 2 months later you test positive. Is that another positive, or are the positives positive test results, or each individual positive? So that question is still up for question. As far as you tested negative and now you test positive, or vice versa, I'll ask public health how that's tracked in the system and be able to report back. But it is important, you know, we do hear a lot of the times when we get dispatched, especially to calls, well, they tested negative last week. That can change. If you were negative last week, you might be positive this week. So it is important for everybody to be aware, just because you were negative once, that can change.
And that, just as a follow-up, it's not so much being tested negative and then contracting it. It's actually being reported as positive when you actually don't have it, and having that test validate that you don't have it. How does that pan out in the numbers? And then at what point does that get updated to the public?
I'll ask that question to public
And
health.
maybe to add to that, is there a percent false positive national number that you can share, Dr. Katie?
You know, I'm just, you asked the question, I'm trying to remember it, and I don't know. I know it's smaller than the false negative. The false negative rate's about 30%. So if you have the disease, you get tested, there's a 30% chance that your test is going to come back negative. And I think a lot of it has to do probably with the quality of sample they take. If they're not tickling the back of your nose enough, it's going to limit the sample. So, so that being said, I think while we want to be accurate, I think the false positives, false negatives may be a bit of a wash for numbers, but that doesn't remove the desire to be accurate. And the other thing that I lost my train of thought as to what I was going to comment about on that, but it'll come back.
Alderman Spiegelberg.
You can stay there. I have a question for the doctor. Do you have any information on where we stand as a county or a state with testing for the antibodies? I know some other states and some other hotspots are having that ability already. Where do we stand with that?
So there's several tests out there, and we don't have a good gold standard as to which tests are valuable and which ones are not. And then the next question is, what do the results mean? Presumably, if we get a positive antibody test, we know that the patient's been exposed at minimum, but probably infected. We don't know yet how long it stays positive for, and we don't know if it confers immunization, you know, that you're not going to contract it again. So a lot of that testing, it's just uncertain as to what it means.
Okay,
So I think that's keeping us from doing a lot of it.
okay. I just read an article, in Madison, they've had great success with using donor plasma, like an over 90% rate of cure. Are you aware of that?
There's actually, UW's hosting a study. ProHealth, I believe Aurora is part of it as well, that we can enroll patients into that study to treat them with plasma. And it is looking promising, but it's still too soon to tell in the scientific standpoint as to whether it's going to be helpful or not.
So you have no idea as far as the antibodies testing? I'm thinking, when you've had the contact that you say, and someone has to quarantine for 14 days, maybe they've already had it.
Exactly.
Maybe they're immune to it. I mean, there's so many working parts to all of
Yeah,
this.
and I think it's too soon to know the answer, but that would be very valuable. I mean, if you've had contact, or if we can start testing everybody, when it comes to the point that we know what an antibody test means, it can be very helpful for us to try to figure out who to take care of.
Thank you.
And back to your point, Mr. Kowski.
You can call me Lou.
Doctor. We called you doctor.
There are two pieces, I think, also to the positives that you're talking about that are false. Just read that article about the Florida case that, I don't remember where I read that, but, you know, they call and say, you know, Mr. Smith, your test is positive. Well, I didn't stay in line long enough to get my test. I think that, you know, people are certainly concerned about whether they're just making positive tests just to be positive, but I think what's happening is they're just not doing a good job of making sure that when they take the swab that they got the person's name and that they're labeling things correctly. I think they're getting a little sloppy with that and trying to move things along with numbers, and they're attributing the positive test to Mr. Smith when it probably belongs to Mrs. Anderson, and they miss that. So that's one piece that we can't afford to be making those mistakes. So that has to be looked at very carefully. So that's one issue where we might have potentially inflated positive numbers that aren't real, and then the other is just the test itself.
Thank you.
Alderman Shellpepper.
Yeah, I was just wondering if we could attribute, because we saw the spike in the last 2 weeks. I don't know if we would call it a spike, but there's been an increase that's been noticed. Been any, I mean, activities that we can like attribute that spike to? I mean, because we can look back to the beginning of May, and that's when I think the state reopened again for business, and so we're seeing this spike now happen, you know, nearly 2 months later. I'm just wondering if we have any idea, you know, what's changed in that amount of time. Maybe it'd be the
I don't
last
know. Yeah, I don't know if we know for certain, but I think it has to do with the fact that, one, we reopened, which is, I mean, we have to do that at some point in time. But I think that we've been enjoying the fact that Wisconsin and southeastern Wisconsin's actually been, we've been doing okay with this. We haven't become inundated, and it has not become a terrible emergency. And I think that that's leading people to become perhaps a little bit more lackadaisical, and they're probably doing a few more things than they ought to be doing. You know, we can open up and go have dinner on a patio, but maybe we shouldn't be getting together 100 of our best friends and having a party and sharing drinks and food and all those sorts of things. Can we point our finger at one episode or, one cause? I don't think we know that, but my hunch is that's what's happening is we've all been cooped up. The weather's been great. We're excited. We're getting out there and we're starting to do more and more, and we're becoming more and more comfortable because we haven't seen the problems that New York and Arizona and Florida have had.
One thing for Alderman, if you can please speak right into your
Yeah, sorry
microphone
about that.
because it's hard for others to hear. Alderman Kavieski? I'll come back here.
There's been a lot of discussion surrounding masks. You have one type of mask. Ms. Conan has another type of mask. If I had a pull-up, that counts as a mask. There's the N95, which is much greater in filtration. Can you, and even if I have an N95 mask on, if I decide to itch my nose or to rub my face underneath that mask or whatever that may be, that increases my opportunity for contracting the virus, regardless of my facial protection. So it's a two-part question. Because there is such a large conversation associated with masks, if somebody feels that they want to take advantage of wearing masks, is there a specific type that you would recommend that provides the greatest protection for them? Is there a way that we can help provide information for our residents that decide to wear masks, the proper way not just to wear the mask, but to conduct themselves throughout that period of time when they're in that environment that they feel they need that mask? And from a scientific standpoint, if you could help provide the information associated with the size of the virus to the filtration through that mask, that's also been on a large point of discussion. So if the virus is smaller than the filtration with the mask, then where is the medical benefit in wearing the mask?
There's a lot there. I mean, we could probably have an hour-long presentation on masks themselves, but I guess to go back to the start, this country's not been used to, citizens walking around wearing masks. So that really, to begin with, wasn't much of a thought, and quite frankly, we don't have a local understanding of citizens wearing masks. But people are getting scared, they're getting worried about this, and the directive came out that from the CDC and others that citizens should not be wearing masks because we did not want people going and buying up all the masks so that our paramedics and EMTs and our nurses and doctors don't have them when and where they need them. And there's certainly the people that are at most risk for getting this. I believe out of an abundance of caution, the first recommendation was to use the N95 mask. An N95 mask means it will filtrate 95% of particles that are 0.3 microns or larger. So 95% of them, not all of them. And there are N99 or N100 masks that'll do 99%, but N95 is kind of the medical standard. The virus, I don't remember the exact size, but it is less than the 0.3 micron.
Something I believe.
But generally, for it to get from point A to point B, it's got to hitch a ride with something, a droplet. Again, those are things that early on we didn't know for certain. I think there's still a little bit of uncertainty on that, but I think we're feeling from a medical community more and more comfortable that it is being spread by droplets. So even though it's smaller than 0.3, it's hitching a ride with something that's larger. And that N95 should do a good job of keeping it from getting through the mask. There was a study done a few years ago, published in, I think it was New England Journal, if I recall. They compared healthcare workers wearing N95 masks to regular, just plain old surgical masks for preventing the flu. And that had demonstrated that the plain surgical mask was just as effective at preventing the spread of flu as the N95s were. my experience, working with these patients, and we're wearing these predominantly, we use the N95s only if we're in a high-risk situation where we're intubating somebody or doing something where we're going to be stirring up a lot of secretions and getting them in the air. But for our typical interactions with patients, we're wearing surgical masks, and the number of our providers that have contracted the COVID-19 is not large, thank goodness. From the public's perspective of wearing a mask, be it a surgical mask like this or a cloth mask like that or a little hoodie that you pull up, really the idea is to try to cut down the spread of any droplets that come out when people are talking, laughing, that sort of thing, coughing, sneezing, etc. Is this or the cloth going to keep all of that in place? No. Is it going to slow how fast it comes out? Without a doubt. I mean, I think even the flimsiest of a cotton mask is going to slow that, so it won't travel quite so far. So if you use a mask in combination with social distancing, you really provide some effective control. And I think the public wearing a mask, it's more about the asymptomatic person that's walking around, that they keep whatever they're spitting out of their mouths to themselves and it's not getting around. I think for the citizen wearing a mask, it's not necessarily going to keep you from sucking in a droplet or something that's out there that may be contagious. So it's more important for people to wear them to prevent spreading it as opposed to wearing them to prevent catching it. And that's the difficulty with it, because it's more so wearing it for other people that you can't understand what their risk is. You don't know. Does the person next to you have a high risk or low risk or what their situation is? So that becomes challenging, very challenging. But I think these masks, again, they're not 100%, but they're going to help minimize the spread.
Alderman Zapfel?
Thank you, Mayor. This is a couple things here bunched into some remarks that I put together as I was thinking about this and from the previous presentations and some of the research I've done. The pandemic has shown that small businesses are the lifeblood of our economy. The recovery from the economic crisis caused by the pandemic should start with the middle class and small businesses rather than big corporations. Retailers, restaurants, and other businesses across the country and our community are requiring customers to wear masks, or they're going to be requiring customers to wear masks in effort to control the spread of the coronavirus pandemic. The National Retail Federation has called on retailers to set nationwide mask policies. The United States Chamber of Commerce also supports wearing of masks. If we truly want to get back to normal, to have our kids get back to school, to see our high school students playing football in fall on the football fields, and to get our businesses back up and running and our economy back, it's going to take some personal sacrifice. The sacrifice of wearing a mask is, I think, absolutely worth it. I have one here. I wore it in, I'm going to wear it out. And I've been wearing it after I went and got tested recently as well. Cloth coverings are one of the most powerful weapons we have to slow and stop the spread of the virus, as the doctor just said. Particularly when universal within a community setting, all Americans have the responsibility to protect themselves, their families, and their communities. The legislature sued to prematurely end the stay-at-home order. While cases of COVID-19 were still growing and leaving the legislature has left us without a plan. Put some thoughts into this. I've noticed some other communities are doing some things. Just want to float this out there. If I'm able to pass this out to everyone, I printed off the resolution from Brookfield. And then I don't believe Bob's here. Duffy?
Yeah, he's not here, no.
And I don't know if this will be Bob or another staff member, if they could just get the opinion of DOBA and the chamber. Just be curious to see what their thoughts are on this. I realize we're in a hard spot here. We don't have a city health office, we have a county health office. The city of Brookfield has put forth a resolution that they're discussing right now as we're having our meeting here. That Diane has passed along. Just a thought here. I know the enforcement of everyone having a mask would be hard. It's just a thought for something for us to potentially look at. And then another question is, I don't know if this would be to the mayor, Diane, or Stan, is our executive order that we voted on previously still in effect in regards to the pandemic?
I don't recall. I don't believe it is. I think there was a termination date on it.
It was terminated in May.
Okay, thank you.
Alderman Ellis.
Thank you. This is for the doctor. I know that we breathe in 21% oxygen.
Can you speak into your microphone, please?
I'm sorry. Can you hear me now?
Yes.
You bet.
Okay. I
Better
know that
than my cell phone
we breathe
coverage.
room air of 21%. I've been asked on several occasions by wearing a mask, does that reduce that that percentage?
I don't believe it's specific, I don't believe it reduces it significantly. I don't know what the numbers are, but I do know that if we're talking about N95, respirators are the more robust masks that filter more. We do go through a health questionnaire and an assessment to make sure that we're healthy, and there are some contraindications with people that have severe lung disease and other issues because there is some issues there. But with regards to the plain masks, be it cloth or surgical, or there's no recommendations that I'm aware of that talk about the health of the wearer in regards to whether they can or not, and that to me implies that there's no significant decrease in the percentage of oxygen. And the other thing that you might hear is people talk about, you're breathing in what you're breathing out so that your carbon dioxide level may actually increase as well. And I think that that's insignificant from, wearing simple masks.
Okay. So those individuals that may have COPD or something along those lines, would you recommend, what would you recommend for them, if anything at all?
From my experience and expertise, I don't think that there's any contraindication to a COPD patient wearing a mask. In fact, some of them wear masks, particularly in winter, because they're sensitive to the cold air, and the masks actually help filter the cold out, for lack of a better description. So some COPD patients actually elect to wear masks themselves to protect themselves from cold air.
Thank you.
Alderman Kavieski.
I just want to go on record, and I appreciate Alderman Zaffel bringing forward some policy that is being considered in Brookfield, which is in Waukesha County, and I know there are other municipalities that have engaged in other policy consideration that mandate specific health precautions or safety precautions in regards to what may or may not be worn. I do not believe that the state Supreme Court issued a reversal of the stay-at-home prematurely. It was an overstretch by law in regards to the implementation of that, and I will not. I absolutely encourage our residents to participate as they feel fits their health concerns, wherever that may be. In the Waukesha County recommendations, the CDC recommendations, but I will not consider supporting any mandates for what our citizens should wear. So just going on record for that.
Alderman Spiegelberg.
And I want to thank Alderman Zaffel, and I want to thank you for your comments too. But I think this conversation should be a part of a bigger picture. Like the mayor said, we need to start thinking through what we want to do. Do we want to be proactive? Do we want to be reactive? Or do we want to just do nothing? And that we don't have to determine tonight. I think you're saying that as we go forward, we need to come to some discussion and consensus between the group.
Yes, I mean, that's up to you guys, and I will help to facilitate that if you so wish. Alderman Mulder?
Yes, Sir Chief. You mentioned that we were at, I think you used level 1. We hadn't risen above level 1. What dictates we're at level 1, and what's the progression up to level 4? What indicators are there that we made that transition?
It's truly based on the call volume of EMS within Waukesha County. Going from level 0 to level 1, that was the transition of implementing our new response plans. Our normal response plans did not change from what they used to be. There was a pandemic response card implemented as well, that if Western Lakes had all 10 of our ambulances out simultaneously, at a click of a mouse, dispatch could bring 10 more ambulances in automatically into the Western Lakes communities. So those were some of the changes going from 0 to level 1. If all of a sudden, as Waukesha County, like I said earlier, our call volume collectively jumps 25%, where ambulances are pinging back and forth, or there's delays because there's not ambulances available, that would kind of flag going to level 2, which means a low acuity, non-emergency type call would get pended while emergency level calls were handled first. It would also refer individuals reporting symptoms that were not life-threatening to the 411 hotline for public health first before calling an ambulance to that location. Those are kind of the differences as we transition.
Okay. So as I'm thinking about this, those are really trailing indicators of an increase in activity of situation like this. Is there, and this may be for you or for the doctor, are there good leading indicators that we should be looking at? Because hospitalization is really a poor, I mean, it's a demonstration that something is really flaring up. But as a governing body, how do we get ahead of that? Because saying put your mask on once hospitalizations are going through the roof, we've got a couple more weeks before that's even going to help us. So how can we get ahead of that? And in your opinion, are we at a point right now where we should be thinking about that from your professional opinions?
I'll give you my professional opinion, and then Doc or Cap can jump in. But as far as the indicators, and that's where I keep providing you with multiple resources. It's a collective approach of monitoring, not just locally here. It's what's happening in the region, the Midwest. That's why we've been monitoring down in Texas and Arizona and Florida, so that we can see what their trends were, what were their early indicators, so that hopefully we can catch those ourselves. Us, we're fortunate that we're able to learn from the East Coast and down south, so that we can get that data from them. But like Dr. Katie said earlier, some of the data points just aren't available. It takes a little bit of time to true that up. So there's always a little bit of a lag. But looking at, we are seeing a little uptick, like Chaz said, with regards to our positive cases. Our hospitalizations the last 2 weeks within Waukesha County have seen a little uptick. So are those early indicators? I don't know if that's enough data yet, but we're trying to look at all of those pieces to at least try to be a little bit proactive instead of reactive, because the reactionary is where we run short on supplies, short on equipment, short on availability of resources. Doc, you got?
I'm not one to be an alarmist, and I'm still very hopeful. And, looking at the New York City situation, I think it's hard to compare anybody to that. That city's so massive, it kind of stands alone. But when you look at what's going on in Arizona, Texas, and Florida, I can't see anything that's unique to those locations or that are different from what we are up here. And their indicator was just their test rate going up, and now their hospitalization rates are at capacity. I hope it's not true, but I just wonder if we're not, 3, 4, 5 weeks behind that. And I would hate to find out that we are without being prepared for it, but I think we've laid the groundwork to be able to respond. Are there other things that we can do from a proactive standpoint? Potentially. But that's the best I can say, is I don't think we've seen any indicators down there that we can replicate here.
Okay. Another follow-up?
Sorry, just in your opinion, if you were on this governing board, would you recommend that we have all citizens wearing masks in public?
That's a tough question. If I could be in a bubble of healthcare and nothing else, I think everybody should wear masks. But I understand that there's compliance issues, there's freedom issues, there's comfort, there's a whole lot of issues that go into it that, that's why I think those decisions have to be made by people like you, based upon what you're hearing from myself and chief and citizens and others.
Thank you.
And I'd like to just add a comment before the next question. As acting city administrator, I want the council to be aware that the department heads, we're all working together to be very, very proactive. So when we see this uptick, we're making proactive stances now. We're not going crazy, but each of the department heads, they do different things. They're different environments, different type of work groups, and we're working individually with each of the department heads to try to keep our employees safe, and important, keep the services open. Power and utilities, we want to keep the lights on, right? Especially the air conditioning. But we also have to look at those same aspects, and I've worked directly with Chief Pfister, who's done a spectacular job of trying to work from a police officer standpoint in conjunction with our fire department as well. Because if we lose some of these people, where are we going to get them? You know, and so if we get into a situation, we have to have a backup plan. And that's what they're working really, really hard on. And, you know, hats off to all of the department heads, guys. They're digging in deep. They have all their proposals to me. I'm meeting with them one-on-one. We're putting action plans in place with the direction and support of Kevin Freeber to make sure that we're proactive here in case something happens. There are not any huge mandates of any kind. There are directives from each of the department heads based on the uniqueness of all of the different departments and how they work. And so, Dr. Katie, that's been our approach here at the city, and we're pushing pretty hard because I think we've been fortunate to live in our bubble, very fortunate. And as soon as we start to see an uptick, we have to kind of refresh our memory about what's going on. And what I don't want to do is see mandates from other states that put quarantines on people coming from Wisconsin into their states. That's already happening. There's a chance that will happen for the state of Illinois. So when we start looking at these things, these affect our businesses. These affect our livelihoods. So that's been our approach, so to inform council of what we're doing with our staff and our people, because we don't feel comfortable with the way we've been operating. But this is something not just we're doing the last few days. We've been working on this for a while. Alderman Kavieski, you had a question.
From a health perspective, from a proactive policy standpoint, would you recommend that we don't entertain individuals from outside our community as we develop a bubble associated with our residents? Is that a step that should be considered in your health care opinion?
Can you define people outside of our bubble? That might help a little bit, Lou. You kind of lost me.
Could be Delafield. I don't know. Delafield, Milwaukee, Madison. As you define a bubble, I think it's wrong. My point is, I think that's wrong in regards to policy. There are going to be people that come into our community to enjoy our natural resources, to meet with family and friends. That is the nature of being a human being. Again, I appreciate the opportunity to have this discussion and being proactive, reactive, or just status quo to me is being respectful to your neighbor, to your family, to those in high-risk groups, understanding and knowing the recommendations that healthcare professionals put out, and then applying those in those situations for your benefit and for the benefit of those around you. It becomes a very slippery slope from a policy standpoint, I would imagine, because ideally, socially distancing in conjunction with wearing a mask, in conjunction with isolating segments of our society and residents, all of those things then potentially get put on the table. It's really easy to overreach. We have constitutional protections. Those who don't feel that those should be considered because of the health care implication, the Constitution overrides that. This body is our first defense in providing policy that doesn't overreach to that extent. The second is the judicial branch, which already weighed in with the Wisconsin State Supreme Court in regards to the stay-at-home order. And ultimately, our residents defend those rights. We need to be very careful as we have these discussions to make sure that our residents understand the nature of these conversations and what we're looking to do. And right now, again, I believe having you as the healthcare professional, and I truly appreciate it, and I truly appreciate the position that you're in every day to be able to bring us this information, as well as Captain Pfister and Chief Bowen. You guys are firsthand experiencing the concerns of our residents and the legitimate nature of a virus that can be anything from asymptomatic to deadly. So again, when you get into mandates, Mayor, you very you articulated well that you're looking at implementing certain guidelines per department based on the individual nature of what that department does. And when we make mandates, they're sweeping.
Yeah, and I think we need to kind of come back to the center here. I'm not facilitating saying that we need to do X, Y, or Z. What we're trying to do in today's discussion is surface and grab the facts so that our council is informed. And then back to the point, where do we go from here? Because it's something that we have to discuss. Our community needs to know where we are.
Yep.
And I think we're doing that now, and I'm very proud. When it comes to overreach or going down a path, you know, frankly, I've gotten to know all 8 council members, and I'm very confident that you are going to look at this with a very fine-tooth comb and really look at this and try to make that good judgment that you think is best for our community. So let's continue with the discussion to gather as much facts as we can from these professionals, have a good understanding of where we are today, and then if you want to go down a path, all you have to do is let me know, and I'll try to gather the information, put things together to try to help you make the decision as our policymakers. That's really the goal of today. Alderman Rozak.
Boy, the agenda looked really light today. Still 8:30 already.
Yeah.
Just a few quick comments. Guys, thanks for coming. It's always tough to answer questions on the fly. I do that as part of my profession, so I appreciate you guys coming in and getting put under the spotlight and answering tough questions. And when people ask you for your medical legal opinion, usually that's not done on the dais up here in a moment's notice. But just a few quick observations. I think there's being proactive, but also being overreactive, and I think we have to be careful about that. I ran the numbers, and I didn't go to school for math, but based on the actual positive cases in Western Lakes on the numbers of individuals, you have a 0.006% chance of getting testing positive right now. So I think we're doing good. I think people are taking appropriate personal steps, and I think it's smart for us as a community to keep monitoring this right through the folks that we have standing here. And if it becomes a bigger issue, if there's significant upticks or significant hospitalizations, I think that's a chance for us maybe to reevaluate. But right now, we're getting the weekly reports. I'm not concerned with what I'm seeing right now. I don't think we can ever restrict people from coming in. I just came back from the city of Milwaukee today. I was downtown all day. They have a mask mandate in the city of Milwaukee, and I'd say less than 50% of people walking in the street weren't wearing one. And they were walking by me, and they were walking with each other. And as soon as they stopped and got their Starbucks, they walked out, took the mask off. So it's really, that kind of thing can be real tough. So I think we need to keep monitoring. We should be proactive in that sense. And if it becomes more of an issue, or we see significant ICU beds, significant hospitalization increases, maybe that's something we address at that time. And then weigh that decision when there's a little bit more of a crisis. So thanks a lot for coming, guys. I appreciate everyone's time putting that together.
Other comments from council? No other comments. Thank you so much, all three of you, for coming. Kevin as well. We really appreciate it and keeping our community informed. Dr. Katie, I really enjoy and try very hard not to miss any of those calls. So
Thank you.
we're taking that information. And council, so from our last update from last Friday that we presented, Chief Bowen and I are trying to customize these reports so they're a little quicker to read, have some metrics that can give you a bigger picture. So if you have any suggestions, please reach out to either he or I, and we'll try to continue to fine-tune those moving forward. So moving on with our agenda, we're now into the citizen comments. We're going to start first with a letter that was received, an email that was received, and Ms. Cohen's going to read it for the public.
Thank you, Mayor. This letter, or this email, was from Rick Gotthaus. He is the president of the Oconomowoc Area School District. It reads, as president of the Oconomowoc Area School District, I am writing for the purpose of strengthening our collaborative efforts on behalf of the health and safety of the people in the communities we have been elected to serve. In order to fulfill our collective obligation to provide a quality education for our community's children, we need to do all we can to support the safe and prudent operation of our schools. Having students in school with their teachers and classmates best promotes their education and social, emotional, and physical development. It is also important to parents who need to work to earn a living and for the general economic welfare of our community. On June 30th, the school board was asked to vote on whether schools should reopen face-to-face as normal as possible or with other organizational structures with stronger mitigation measures. A survey of families showed a majority desiring the face-to-face model. We as a board agreed. The stipulation that if local health conditions remain safe, as they appear to be at that time, we could operate schools safely. In order to accommodate the health needs of our students and families who need to take extra precautions against exposure to the COVID-19 virus, we also offered two other options that provide greater physical distance learning structures. The challenge before us is that the level of concern for the health and safety of our students, their families, and the school staff is growing significantly as we watch the incident of positive cases rise in our community. We will do everything we can to protect the health of our students and staff. If the virus comes to school, we will face mandated quarantines, far stricter mitigation strategies, including students not attending 5 days a week, and potential school closures. In order to keep the virus from infecting our students and staff, we need your help to lead efforts to design and implement specific plans to decrease its spread in our community. I ask you to keep our schools open. Thank you.
Thank you. Next, we have Michael Grady. If you would please state your address. And we try to limit it to 3 minutes. You look like you want to talk about COVID, so I'll give you a little leniency here. Mr. Grady.
I appreciate that. Thank you very much. My name is Michael Grady. I reside at 1180 Dorchester. I'm a 10-year resident of Oconomowoc, District 3, Ward 9. I address you as elected officials, as policymakers. I also would like to say I am cautioning you to consider and recognize your current positions and where that role changes to mandating dictations. I'll try and keep these to within 3 minutes, and so I timed myself earlier. My wife said, hey, Mike, be careful of this. Okay.
Smart wife.
Smart husband, I listened to her.
You get 4 minutes.
Thank you. Okay, this is the danger about the COVID-19 situation. Government officials and bureaucrats deciding and mandating what is best for its citizens. I do not deny the virus or the symptoms or the health concerns for individuals. I'm very concerned and seriously question the actions of government agencies, bureaucracies, the media, and many individuals. Before I go on, first, thank you for hearing the statistics and the information. I'll go. I wanted to thank them as well. That information is valuable. We need to hear that. You need to hear that. You need to make decisions on that to inform the citizens that have elected you to be just that. Give them the information that they can make decisions for themselves. As an example, this just happened today. As an example of this fear that I'm talking about. As an example, let me relay a situation that occurred today, July 21st, while my son was working at a chain restaurant known for its flavor of the day, frozen custard. He was taking an order from a customer. My son was following all safety protocols, mask, gloves, sanitizing, etc., so on. The woman gave him cash for her order. My son took the cash, and he's a very good math student. He was able to figure out the change and got it back to her.
Nice.
Took the cash, put it in the register, and gave her her change. He then retrieved and handed her the cone which she ordered. The lady paused and asked if those were the same gloves he used when he took her cash. He said yes. She made a comment to the effect that he should use new gloves and she would not take the cone. He assured her that he sanitized the gloves between the steps of the transaction and the interaction. This did not satisfy her fear. He needed to put on new gloves. As a result, to satisfy the fear of this customer, a new cone was prepared and served with new gloves. This is an example of the fear of a virus which has less than a 0.05 mortality rate for the US population, the fear which has people laying aside common sense and historical perspective, altering their interactions to a near unreasonable and ridiculous level. I want to relate this to something else that's very prevalent in Waukesha County, levels of radon. I just looked up the EPA statistics and CDC statistics. A person is more likely to develop lung cancer than die from COVID-19. So developing lung cancer from radon is more likely than dying from COVID-19. Again, I'm not denying the virus, I'm not denying the statistics and the need to take personal precautions. But at what point, when did the thought process of the experts change? The medical experts, the government experts, those experts who have determined that teenagers are self-cognizant and have enough wisdom to seek appropriate sexual advice and resources on their own. And yet adults are not intelligent enough to take appropriate precautions for their own health. I refer to the Wisconsin DPI website, Pregnant Parenting and Sexually Active Teen Resources. The suggested procedures for school professionals who become aware of a minor student has had voluntary sexual contact or intercourse with another person. When a school professional comes into contact with a student who is sexually active and a report is not warranted, the school professional may wish to take steps to ensure the student is fully cognizant of the potential adverse consequence of being sexually active, and ask the student whether he or she has accessed appropriate health care services to prevent pregnancy and sexually transmitted infections. And if not, provide the student with the necessary information to make a self-referral. And yet, government officials are now suggesting that adults are not able to take steps to ensure their own health and well-being. Many government officials and bureaucrats are taking steps to mandate personal protective measures, which, by the way, are less secure than a condom at filtering viruses.
I'm going to try to have you wrap up. Are you close?
I'm wrapping up now.
Okay.
If someone, whether a business or individual, decides they choose to need to wear a mask, no one is stopping them. They're adults, they know there is virus around them, they can make that informed consent decision, probably better than a teenager who has knowledge and wisdom to seek sexual resources. You don't want to have other states mandate to Wisconsin as far as who can travel. I don't want my city government mandating to me what I need to do. Inform the public, inform the citizens, inform those that have elected you of the information. They are adults, they elected you, they had enough wisdom and knowledge to make that choice. Give them the information to let them make their own choices. Don't tell us, don't mandate us what to do. That's where the position changes from elected policymakers to passing mandates. Thank you.
Thank you very much. Any other comments from the audience? I don't have any more cards. Okay, then we will move on to item 6, consent agenda items. Do I have a motion for the consent agenda items?
Second.
All those in favor?
Aye.
So moved. Mr. Gallo, do you want to talk about Plan Commission? Consider act on Tower Ridge condominium plat located at 265 Thorough Drive.
Thank you. Planning Department received an application for a condominium plat that is before you this evening. It's located again at 265 Thorough Drive. This is to convert a 27-unit apartment project into condominiums with individual tax key numbers being assigned to them. The project was approved as apartments in 2019. The project was constructed, and during construction, there was a lot of interest in potentially buying the individual units. To date, there's 6 holds on various units right now, with price points for the units anywhere between $250,000 and $290,000. So every unit will be under $300,000 for these. Plan Commission reviewed this request to convert it by the condominium plat, and they recommended approval back on July 8th. There was some discussions at the meeting about deed restrictions being amended and specifically tailored regarding the stormwater management. When you have one owner, he is responsible for the stormwater maintenance and upkeep. When you have 27 owners, the deed restrictions had to be changed that made the HOA then responsible for all of the stormwater management, what the city has interest in maintaining good stormwater management. The applicant has informed me that he has worked those out, and his attorney has restructured the deed restrictions and has worked with our city attorney, and that all parties are now happy with the new language. With that being taken care of, there's no concerns with staff, and we recommend approval of the condominium plat for this development.
Do I have entertain a motion?
So moved.
Second.
Any discussion? Alderman Shellpepper.
Yeah, so at first take, I mean, it seems like it's a great thing for housing affordability, for home ownership. I'm just wondering how, I mean, if you know off the top of your head, how many, condo facilities there are in Oconomowoc that have a price range of between $235,000 and $290,000 for ownership. Is that something you're aware of, or a
I'm not aware of
ballpark?
anything that's remotely new that would be that low.
Yeah.
This is a very inexpensive, price point for people to get in a brand-new unit.
Yeah,
Yes,
so from your
absolutely.
perspective, you think it encourages housing affordability in the city of Oconomowoc, and we're offering an opportunity that we weren't offering before for homeowner or condo ownership.
That's correct. There's single-family homes adjacent to this property. Once they found out that it's converting to condominiums with home ownership and pride in ownership, they were very happy
Yeah.
about this. So they would encourage you as well to approve this.
Alderman Rozak.
Yeah, just kind of a general question. This has happened once before where they built them as apartments, I think over behind Culver's, and then they converted to condos or in the process of converting to condos. As a planner, do you see a problem with folks coming in and trying to build something that's marketed and sold to us as apartments and then changing to condos? I mean, in your head, is there any issues, or as a planner?
No, I think if it was the other way around, and they came in and sold us the project as a condominium with home ownership, and then they flip it and make it into apartments and they rent them all, with transient people, it's just a form of ownership, but still, we want to make sure we understand what they're doing. But this change to condominiums is a much better for the community, I think, as a whole.
Do you think ultimately a better change, right?
Yes.
Okay. Thank you.
The units down by Culver's were never, they were approved to go to condominiums, but that did not
They
happen.
still haven't been.
Right.
Okay. Yeah.
Alderman Kavieski.
I would agree. I think it's a bold statement from a developer that was intending to come in with apartments, converting them to condos and that home ownership, as the desire for permanent residence here continues to be strong, regardless of the economic condition uncertainty that we're in. So
And Attorney Riffle, you wanted to interject?
I want to caution everyone, is an ownership issue, not a permitting issue, and we don't have authority to tell an individual that they can't condoize an apartment complex. We have certain regulations that we can be insistent on, like the issue that was brought up with stormwater, whereas you had one owner that was responsible before to make sure that issues that affect the community at large were dealt with. So we do have certain abilities to regulate it, but we don't have the ability to say, I own a duplex, I can't sell it to two different people. Condominium laws, it's an ownership issue, property right issue, not a regulatory issue.
Alderman Kavieski, I interrupted you. I wasn't sure. Do you have more to add?
No.
Okay, thank you. Alderman Rozak.
And just to that point, Stan, why do we have to approve the plat then? If we don't have any ability, I mean, we're approving to split these into basically separate tax keys. We could just say no.
No. I mean,
Why do we even approve it then? What's the point?
the point is the exact example I gave, where you do have regulatory authority over common areas and that sort of thing. We can give reasonable restrictions on that and make sure that our legitimate governmental concerns are covered. But you look at Chapter 788, trying to remember the condo chapter, I think that's what it is. You'll find in the area of condominium law, it's not something that a municipality can regulate.
Any further questions on this? Call roll, please. Thank you, Mr. Gallo.
Alderman Zappel.
Yes.
Alderman Ellis.
Aye.
Alderman Spiegelberg.
Aye.
Alderman Mulder.
Aye.
Alderman Shellpepper.
Aye.
Alderman Kavieski.
Aye.
Alderman Rozak.
Aye.
We have one staff report today. I thought it was important because there's so much activity and things that change with our park and rec, our programming. We've asked Craig Hepner, our department chair, to give you a quick little update.
Good evening. For those that may not remember me or recognize me, I am Craig Hepner, Director of Parks Rec Forestry, and recently released from the Witness Protection Program, so happy to be here. Come on, we've been here talking about COVID for a while. We got to lighten it up a little bit. Thank you for the opportunity, Mayor. I do want to give you a short, brief update, but the summer of COVID, as we call it, has been a little bit crazy, busy, bizarre at times, challenging, and rewarding. And a big thank you goes to our entire staff because they've dealt with all the issues you've been talking about, we've been dealing with all summer. But some positive things, and I'll kind of go through some stats for you as well. So first off, the waterfront has been extremely, extremely busy. All of the beaches, with many pools and attractions closed in Wisconsin and southeast Wisconsin, and coupled with a hot summer all the way through, we've seen tremendous attendance at City Beach and other beaches. As of June 30th, we did a comparison to last year. We actually have an 18% increase in revenue over 2019. This is starting 2 weeks late with the beach and also canceling June swim lessons this year. So you can tell that the attendance has been crazy. Recreation programs have gone very well. We've tried to make sure we've done as much as we can with distancing and through this whole process. Soccer, tennis, baseball, volleyball, fitness, dance, even preschool class, all going well. Revenue for recreation overall is down between 30 and 50%. But if you remember recreation, also we lower the expenses then with cost of instructors and expenses. So recreation basically holds its own. The community center, that's probably where it's taken the biggest hit for revenue, just because think about weddings. It's been crazy. So the revenue as of June 30th is down about 47% from last year. Many events have moved to either later this year in hopes to run it, or lots of weddings have postponed to 2021. So we'll see them, we've been holding on to them, but the revenue changes that way. We have had more cancellations just recently with the uptick in this, so we're seeing that. But on the positive end, we've had some showers now on our first wedding of the season, and Bridge Church is using our facility through the end of the year at least. We're hoping for longer, so every Sunday morning we have them in our community center. We started doing events, basically the fireworks kicked it off. I hope everybody enjoyed them. Staff between police department, our department, administration did a great job to make that happen. I think everybody's very appreciative that we had something to do in the city and could celebrate. Bands at the Beach have started recently. They've been very popular. The beer gardens have started. We've done drive-in movies at the high school, and we've had 3 youth baseball tournaments at Champion Field. So most things in July have continued as far as events. Parks and Forestry has never stopped, other than we had playgrounds closed back in April and May, but very busy with forestry catch-up work, stumping, storm damage, your typical mowing, mulching, restrooms, lots of athletic fields. I was at the softball complex tonight, and people are enjoying themselves like a normal summer. Downtown, and we've seen a lot more trash this year too, though, in the parks. So I think that's a sign of more people being out, trying to use local parks. And I want to touch on a few projects. So this year we accomplished our, hopefully to eliminate vandalism. If you remember last year, we had a lot of it. We have security cameras in 5 different locations, and they're all plugged in at a maintenance room in those different facilities. We've seen only 2 very minor incidences of vandalism so far. So we think security cameras, along with some of the changes we made with the police department and the court system, has definitely helped that. So that's been very successful. Last week, we installed new LED lights and bollards down at the city beach, which match Veterans Park. So if you see those, we've had those out of commission for over a year, I think. So our staff, and thanks to the electric utility for finding funding for that to convert from what we had to LED bollards. The Roosevelt outfield renovation project was completed, so baseball continues there. Rosenow Creek, I'm happy to report, has finally made substantial progress after a delay with weather and such last year, so that's been asphalted. Most of it's restored. There'll be seeding happening, and I'll bring a full report once that project is completed. And then last on a project currently going on, Blaine Street tennis and basketball courts are doing great. We were worried about some of the subsurface of the ground. It's actually turned out really well, so it's asphalted. We'll be doing fencing and striping very soon in the next couple weeks. Couple upcoming projects. Roosevelt Shelter, we're receiving bids for that coming on Friday, and that'll keep that project going. We were installing new, what I call positive dog signage. The ordinance changed 2 years ago. There was never really signage put in. So we're showing people exactly where you can walk dogs, which is basically asphalt pathways throughout our park system. I talked to a number of you about our skate park idea. We had talks with the town of Delafield over the summer. Right now, it looks like they're going to keep their skate park, but it's not for sure yet. So we're still in discussions with them to see where that goes. A couple of us have met with the DNR to talk about the boat launch project and ask some questions. We're actually looking at putting an RFP together soon this fall to send out for design engineering. There's a lot of components to it, but I think we're starting to make some progress there. And last but not least, because some of our aldermen were with me last night at a Park and Rec board meeting, along with Captain Pfister. And we had 40 people in the audience at the community center, and we mostly were talking beaches. So it's cool. I mean, we talked pickleball lines, we talked beaches, but with, as I mentioned, the city beach being extremely popular this year, not only that, but Park Street Beach, Woodland Lane, and Bender have been probably over capacity in all those situations. Depending who you talk to, there's been issues, especially with the neighbors. Other people really like it. So we had a nice meeting. I thought it was very respectful, lots of great input. The Park and Rec Board made some decisions short-term last night to not allow alcohol and tobacco products in those sites. And we'll be discussing further ideas that can help the situation. It was very clear, though, that people in the community, and we all agree, that those places need to remain accessible to the public. So it's not a private beach, it's open to the public, and that's part of what we deal with. So I thought it was a great discussion. I think it was a good form of good government, showing how people can respond and discuss in a respectful way. So other than that, there's nothing else going on out there. So just a quick update, but happy to answer questions and provide any information if you'd like.
Any quick questions? Alderman Mulder.
Just a quick statement. I thought you handled it really well last night. I think your demeanor goes a long way in keeping a situation like that just kind of calm. You're very matter of fact. Your jokes were terribly timed. that was shown, but otherwise, I really think you set the stage well for a healthy discussion last night.
Thank you, I appreciate that.
Alderman Kavieski.
I would echo that. Having served on Park and Rec, typically the meetings don't have that kind of attendance. So managing through that is sometimes a challenge just because it's not normal, but you did a great job. The board did a great job listening and replying and responding to the concerns of the residents, one of which is me because I live in that neighborhood. And I would and I know you heard it last night, it's not just the beaches, it's really the water access points that we as a city have available to our residents, our community, and to our visitors, and how they're managed and how we deal with the expectations associated with that. So I look forward to seeing hopefully some recommendations to council and some further action by the Park and Rec Board to address that so we don't have to deal with it again next year.
Thank you very much. We'll move on. One more staff report I forgot. Finance Director, Ms. Sullivan.
Hi, thank you. I have this
Thank
for
you,
you.
ma'am. All right.
This is really a reminder. This is a reminder and a hard copy packet for you for tomorrow night's Western Lakes Fire District Capital Project meeting, and a little memo from me on the top. So tomorrow night, 6:30 at the High School Arts Center. Thank you.
Thank you very much. We'll move on to reports and comments from aldermen. So who do we start with, please?
Alderman Zappel.
So we're going to stay tight to 2 minutes this time, guys.
I'll be quick.
Are you ready?
Yes.
Okay.
All right.
You're on the clock.
Thank you. Thank you, Chief, Captain, Doctor, for coming to give your presentation. Truly appreciate it. It's very informative. Appreciate that again, very much again. Also just want to give a shout out to the clerk and her team. Thank you so much for all the work you're doing to make this upcoming election happen on August 11th. I know there's a lot of people voting absentee. The numbers that you gave me on July 16th at 9 a.m., you mailed over 3,057 ballots, and you had 734 ballots returned. My wife's ballot I just returned in the box this evening, but thank you for all the work you're doing to make this upcoming election happen and all the curveballs being thrown at you and your team to make it happen.
Right. Next, please.
Oh, I'm sorry. I'm not watching my sheet. Alderman Ellis.
Yeah, I also want to thank the chief, captain, and the doctor, and also Craig. Thank you very much for all you're doing, especially at this time. It's been a whirlwind of activity, and nobody knows what's going to happen tomorrow. So I just want to thank you guys for that.
Alderman Spiegelberg.
I will keep it short and just ditto all the gratitude that has gone on before me, and I'll pass it on.
Okay. Alderman Mulder.
Ditto to your ditto, and move on.
Okay. Alderman Shellpepper.
Nothing, no comments today, thanks.
Okay, thank you. Alderman Kavieski.
I'm good.
And last but not least, Alderman Rozak.
No, nothing. Thank you.
Thank you.
Okay, moving on. No reports or comments from the mayor. I'd entertain a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Thank you all for spending the night, and be safe and travel safe.